Come in.
Julie, can we talk?
Susan. Sure, please come in.
It's been 2 weeks since my daughter died, and it hasn't been easy. I just wanted to thank you for your support.
I know it's hard, Susan. I'll do whatever I can. How can I help?
I'm having trouble focusing, and everyone seems to be avoiding me. I think they're afraid to say anything to me.
It's not uncommon for friends or those you work with to feel awkward when a death has occurred. Usually they just don't know what to say, so they say nothing, thinking that it causes less pain. Others might share their own stories of loss to try and comfort you, but it doesn't. It has the opposite effect by minimizing your loss. And each loss is unique, and each person heals in a unique way.
Some of them tell me about their losses. I don't want to hear about that right now. I don't know what to do, but I hate that I feel like this.
Susan, I understand. They want to support you, they just don't know how. They care about you, and it's hard to see you hurting. Their intentions are from the heart, you know that.
I know. Nothing matters right now. And every day is a real challenge. I need to get back to normal. I need to have a routine.
I know what you mean. Routines are good. At work and at home, they help us feel like ourselves again.
Now, it may sound odd, but routines are very important when you're grieving. They're a huge part of self-care. Grief and loss take away feelings of safety and control. Reestablishing regular routines is one way to regain safety and control in life.
Julie, I need your help to get back on track. How do I begin?
Susan, everyone grieves and heals differently. You've lost your daughter. That hurts. Only you know what you'll need to heal from that. But I sure can help you. I want to help you.
I need help getting back to a routine. How do we start?
Well, a referral to our employee assistance program offers lots of options. We could reduce your work schedule, maybe turn over some of your tasks and lighten your workload for a while. How's that sound?
That sounds pretty good. The mornings are the toughest for me right now. That's the time I spent getting my daughter ready for school. If I could just come in an hour later and share some of my projects, I think that would be good.
And we can help you with your team members when it comes to talking about your loss.
Offering and receiving assistance with the team member's workload can be very helpful during the grieving process. Let them set the tone for the conversation. This is an important element for building a routine and getting things back on track.
Julie, there's one more thing I need to say to you.
What's that, Susan?
I can't afford to lose my job right now. I'm just having trouble focusing, but I like this company and I appreciate everyone I work with.
No worries, Susan. We appreciate you too. We realize loss happens and we do our best to make things easier. Our programs really help.
Be sure to summarize the content of the conversation with compassion and empathy. Allow your concern and caring to show. Understand and respect the griever's need to share and grieve well after the death.
Julie, thanks so much for talking through this with me. I feel a lot better.
You're welcome. I'm glad to help. So it sounds like you're telling me that a lighter workload, a reduced work week for a while, and a referral to our EAP program will help get you back on track. Do I have that right?
Yes, that would help a lot. My husband and I are just dealing with things very differently right now. It would be a relief not to have stress at work too.
Continuing to receive support is an important part of the healing process. We all need love and support. That need never ends. Embracing the pain of loss requires support and compassion. Support through EAP programs such as brief one-on-one counseling or grief groups are a wonderful way to work through the pain of loss. Additionally, sometimes our existing support system is unable or unwilling to provide the compassionate support we need while we grieve. Many support groups exist to provide that compassionate outreach in the community. Employers have access to these community resources through human resources programs.